everyone. I'm Dr. Sanjeev Bisla, phaco and refractive surgeon from Dayal Eye Centre, Gurgaon. So today we'll be discussing about the various refractive techniques, laser-based vision correction procedures that patients considers for removing his specs. So before discussing that, I would like to discuss in brief about how the procedure is done. So I've got a model of eye in front of me, and if you can see, this part of eye, which is called as cornea, is fired with laser to remove specs. So in a routine procedure, the word LASIK that we hear usually, in this we raise a partial thickness flap. Suppose this cornea is 550 micron thick, so we are going to raise a flap like this, 100 micron approximately in thickness, and fire the laser for the required power and put this flap back. So this is what LASIK is all about. Okay, so if we raise the flap with blade, we call this as microkeratome assisted LASIK, and if we raise the flap with laser, we call this as femto LASIK. And suppose we don't want to make this flap and still do the procedure, then there are two ways. One is the smile. So in this procedure, we are not going to make any flap. We rather make a small incision with laser only and fire the laser through the intact cornea in the deeper plane and the superficial plane, thereby fashioning a small lenticule as shown in this picture. So this lenticule is then taken out through that small hole and the procedure is completed. Okay, this is smile. And one more procedure, when our pentacam is not conducive to either of these procedures, then we take the patient up for epicontura. In epicontura, we are not going to make any flap, we are not going to take out any lenticule, we straightly remove the top layer of cornea, which is called as epithelium. Then we fire the laser again to remove the patient's power. So the problem with PRK or epicontura is it takes a little longer to heal, because this epithelium is like we are fashioning a trauma on the eye, and it takes around 5 to 7 days for this to heal completely. Okay, so now so many patients keep on asking us which procedure is best for my eyes. They give us a phone call. I mean, you cannot really make out without seeing patient's biomechanical strength of cornea which procedure is going to be the best for the patient. So we need to do a test to assess the strength of cornea by a procedure called pentacam. That will dictate us which procedure is going to be the best for patient. So for a person who spends a lot of time on computer or on screen, probably not creating a flap would be a better idea. That is, doing smile is going to have its own benefits, because we are going to cut only 2 to 3 mm of cornea. So the corneal nerves are spared, they are not cut. So lesser chances of dryness and faster rehabilitation. For somebody who wants perfect vision next day and dryness is not a problem for him, probably doing LASIK or contoura LASIK will be a good idea. For someone who's into sports, contact sports especially, probably doing epicontura or PRK would be a better idea. Why? Because there is no flap involved, so flap related issues or long-term complications are avoided. In smile, the long-term safety is the best. You're not creating any flap, so flap related issues during surgery and after surgery are avoided. The only issue with smile, I feel, is a little costlier procedure. So if somebody can afford, nothing like smile. For patients with plus powers or high cylinders, we can do smile. For them, probably the best procedure would be contoura LASIK. If we do pentacam test and patient is fit for all the procedures, then probably doing Smile would be the best way to go forward, especially with low cylinders or a spherical power. So patients, myopic patients means patients with minus powers, with lesser cylinders. Lesser means less than 3 diopter cylinders, and they can always go for smile. Patient who want quick vision, next day perfect vision, probably smile would be the best one. Those who can afford to give 2 to 6 weeks off time from their job, probably doing apicultura or PRK would be a better option.
So since you're doing both, we can ask you one question to sum it up. For your family, what would you choose?
Yes, for my family, if their pentacam report is fine, if I'm free to do whichever procedure I want to do, and they don't have very high cylinders or they don't have plus powers, probably doing smile would be the better option. Since it offers you faster rehabilitation, in 5 days time they are back to their work, they are back to their screen, and of course we are avoiding all flap related issues during the procedure and in long term. Thank you.